Hello, everybody. Welcome back to the Beat podcast at Health in Las Vegas. I'm excited to be hosting David Cohen today. He's the Chief Product and Technology Officer at Greenway Health. He's passionate about technology solutions that allow practices to thrive. I'm excited to talk to you, David.
Yeah, it's great to be here, Saul. Thanks for having me.
Of course. Yeah, it's a pleasure to have you on. And so how's the conference going for you?
It's going great. It seems like there's a lot of energy here. I can say personally, I've been back to back with meetings, so there's definitely lots of business activity happening here and a lot of great partners that are present this year.
Yeah, so tell us about Greenway. And it sounds like you're here, you're meeting a lot of partners. So tell us about Greenway and what you guys do.
Sure. So Greenway Health, we are a healthcare technology solutions and services company. We service the independent ambulatory market. We have about 40,000 providers across the US that use our products and technology. That's spread across approximately 4,000 healthcare practices and organizations. And we deliver full-scale solutions and services for our customers. So we do electronic health records, we do patient engagement, revenue cycle services. We try to offer everything that an independent ambulatory practice is going to need to run their business.
I think that's great. And how do you define ambulatory?
Ambulatory in particular, we're working with independent ambulatory. So these are typically healthcare organizations that run independent from acute care or from larger integrated delivery healthcare networks. So, everything from 1 to 2 doc practices all the way up to, I would say, more multi-specialty enterprise ambulatory organizations that are in the 200 physician and up space.
Got it.
We run across all specialties. So I think that's another important factor that differentiates Greenway from a lot of the other EHR players that you'll see out there. We cover a very broad range of specialties. And that's one of the things that makes our products very attractive for that multi-specialty market.
Awesome. Well, thank you for that. I always like to level set on definitions. So
Absolutely.
It's clear. Clarity is great. So David, let's dig in. How does Greenway's approach to automation? There's a lot of data here. Automation, AI. How does your approach to automation in the ambulatory healthcare space differ from other vendors in the space?
Sure, absolutely. And that's something that's interesting because there is so much AI and automation happening right now in the industry, and you can certainly feel that at Health this year. Our North Star is building an agentic AI-powered ambulatory practice where front, middle, and back office workflows are supported by intelligent agents that are streamlining tasks, right? Mm-hmm. And we really believe that agentic automation is going to give practices more time to spend on patients and patient care. So how we different from a lot of the competitors that I see out there in the market in the industry is that we're very focused, number one, on building end-to-end workflow, right? And I think that's a big difference because we've gone through this as well internally within Greenway of what is our overall approach to agentic going to be? And we realized that we have to just be more than identifying and creating kind of point agents within our established products. But to really do this right, we have to think about agentic in a different way. And I think this is one of those true inflection points in the industry that really warrants a different frame of thinking. So we're looking at end-to-end type workflow experiences. We call this our encounter to cash workflow for ambulatory practices, where we're really thinking about everything from pre-visit and the start of the visit encounter all the way through helping supporting practices with cash collection. So thinking about how agentic orchestration can support that overarching end-to-end workflow, I think is one of the things that differentiates us in terms of our approach. And another thing I would say is our agentic-first architecture. So to do this end-to-end right, you have to really think about this as kind of a grounds up build, right? Because agentic AI really becomes the product at that point. It's not an umbrella, it's not an enabler, it is the product. So we're looking at the entirety of that encounter to cash workflow with an agentic lens, an agentic mind frame, and just not being afraid to be bold and reimagine what that workflow could actually look like.
I love that. Thanks for that framework, right? From front of the office, middle to the back. Making sure that the technology is not a point solution, but integrated, ground up, making sure that, hey, at the end of the day, the agentic is the product. Can you share an example of how automated healthcare practice, this vision that you have, will support improved patient outcomes and also enhance workflows for healthcare providers?
Yeah, absolutely. So one of the things about our approach is that we really prescribe to this working backwards model, which I think was kind of derived by AWS of working backwards from the problem statement, right? So we work very closely with our customers. We have advisory boards. We have very informing customers that are working along with us on this journey. And we're very focused on what are the specific practice outcomes that we're looking to impact. So for example, one of the goals that our customers have is they want to be able to drive more throughput through their practice without having to increase staff, right? All of our customers and a lot of healthcare suffering from staff shortages. So then the question is, okay, how can we do that? And how can AI in particular help practices to do that through automation?
Mm-hmm.
So one of the obvious answers, right, that we're seeing pretty ubiquitously across the industry is ambient documentation. And we have very good proof points. We launched that product close to a year ago now for our customers, and we're seeing very good time savings opportunities. And not only that, very high quality of clinical notes. But I believe documentation is only one part of that overall visit experience. So now we're looking at how we can drive time savings through other aspects of that clinical workflow. So things like chart review and guided ordering workflow and automated charge capture and billing. I think documentation and the great results that we've seen is really only encapsulating about half of the overarching time savings opportunity we have. And that, again, is going to be more time for our practices and staff to see patients and really make healthcare more accessible to their patients, particularly in a lot of underserved communities. We do a lot of business with federally qualified health centers, and access to providers is very important for that community. So that's one of the things that we're trying to impact. If I could give you one more example.
Yeah, please.
In the revenue cycle, a lot of our customers are focused on first pass claims rate and faster cash, right?
Mm-hmm.
Claims to cash. What we've heard from them is that the way they really want us to address that is by automating and bringing a lot of the payer rules, eligibility, insurance discovery, things that might have traditionally happened either manually or later in the overall encounter workflow, to bring those things earlier. The more we can identify and address errors and issue and documentation, align that with what payers are expecting with claims, the better job we are going to do with first pass claims rate and improving cash collections for our customers.
And it's just essentially becoming that one-stop shop, right? The fully integrated one-stop shop for the provider.
That's right. And I think that's also one of the things that I think makes Greenway unique is that we do have that entirety and breadth of workflow within Greenway. So we have the patient experience, the clinical experience, the revenue cycle experience. And I think that's one of the ways in which Greenway is able to think about this problem uniquely, is that we're not just looking to solve revenue cycle, but also thinking about how revenue cycle really starts at the front of the encounter. Mm-hmm. And we can use that whole clinical workflow to drive revenue cycle outcomes.
That's fantastic. I really appreciate that. And so how does Greenway plan to integrate AI into the automated healthcare practice vision to enhance its capabilities and outcomes?
Yeah, so AI is going to be, again, kind of foundational to everything that we do. So if you think about reducing the administrative burden that's on physicians today, we talked about documentation. Well, we're now working on some pretty exciting things around this whole kind of chart review process, which traditionally chart review in EHRs has been this very compartmentalized, needle in the haystack type thing. We're approaching chart review in what I think is a pretty unique way. So number one,
I'm just curious. So at what point does that happen? So from encounter to cash, chart review is before the visit?
Exactly.
Right?
So that could be before a visit or during a visit when the physician is, encountering a patient and really trying to assess, okay, why is the patient here? What do I need to do for this patient? Is there anything going on with them clinically that I need to be aware of? Mm-hmm. And can I discern from the breadth of clinical information, really what I need to know? Yeah. That's always the hardest
15
thing.
Minutes.
Exactly.
Yeah.
So we're approaching this problem slightly differently. Number one, we are integrating into that experience data liquidity and care coordination. So tying that in with some of the platforms investments that we've made, specifically working with AWS and their HealthLake platform to build this patient longitudinal record where we can incorporate data sets from across the industry. And obviously that's really important from a care coordination perspective, as
Yeah.
well as from a care gap closure and care gap identification perspective. Number two, we're also focused on patient experience. And I talked a little bit about that, but really thinking about this digital first experience and how that's going to change and transform the way all of our customers, the patients, interact with healthcare. So thinking about automating through agents, things like eligibility, checking, insurance discovery, and ensuring that patients know and are aware of their coverage status before the visit. And that will really help them and their experience with the healthcare system, reducing things like surprise billing and just improving the overall confidence that they have with their healthcare provider. We're also working on self-service tooling for patients. So things like scheduling, reminders, intake, and also supporting those with AI and AI intelligence to make those workflows easier for patients to navigate.
Yeah, some very useful integrations of this technology to help across the encounter to cash journey.
That's right.
Love that. I'm definitely feeling the language here. The Greenway language.
You're getting it. Absolutely.
For sure.
Yeah, encounter to cash is something that we're excited about. And it also resonates with our customers because just that term alone really embodies this notion of full end-to-end workflow, which is something that we believe in and we're so passionate about.
Love that. So look, we're here at Health, and there's a lot of visionaries here, yourself included, on sort of where the bets should be placed today. In 3 to 5 years, what bold bet is Greenway making that you believe will truly transform the healthcare experience?
Yeah, first off, as you said, everyone's got to place bets. Number two, if it takes 3 to 5 years for us to get there, it's too long, Saul. And I think that you're probably also seeing that, right? Everything in industry right now, and I'd say particularly our mindset at Greenway is time compression, right? We see the opportunity in the market. We want to get there and we need to get there quickly. So we're not just talking about and thinking about bringing AI tools to bear to market. We're also thinking about how we can bring those tools to bear within our own internal organization so that we can accelerate speed to market. Because when we're talking to our customers, they don't have time to wait. If we talk to them about 3 to 5 year roadmaps, we've already lost them. We need to be talking about 3-month roadmaps and 6-month roadmaps and really talking about the things that we're delivering for them today. So that's where a lot of our mindset is how do we do these things and how do we do them quickly and get those things to market? Our big bet is on building out this encounter to cash workflow, which we're anchoring around this notion of the automated healthcare practice. So wanting to automate that breadth of workflow for our customers for us is critically important. And that's the North Star that we're focused on.
Well, the North Star is clear, my friend. Let's follow it.
Absolutely.
Love this, David. I really appreciate your thought clarity. And by the way, as a product guy, like you got to think in sprints, right? Like 3 to 5 years, you'll lose people.
Absolutely. And it's actually, if you talk to folks on my team, this notion of sprints even is really changing. I think, I've been working in software development now for 25 plus years.
What'd you do before Greenway?
Well, I was at another larger EHR company before Greenway. So I've been in the EHR space
for a while.
In particular.
You're an EHR veteran.
That's right. For 20 plus years. I always tell my children, I'm like, this is the great failure that I feel I have in life right now, that I still have not solved this problem, right?
Oh, man.
My personal life's work here is I want physicians to love the EHR.
Oh,
and
man,
I'm going to keep working until we get there.
That's a big one.
And, as someone that's been working in the industry for so long, trying to solve these problems, it's just amazing to me how technology today is enabling those problems to be solved, right? Things that we might have spent years working on, we can deliver to our customers now in weeks. Mm-hmm. So it's just really fascinating, this notion of time compression and how technology is really supporting and enabling just the amazing things that we're going to be able to deliver to our customers, even in the next 12 months.
That's fantastic, David. And hey, who doesn't want more time compression, right? You're listening to this and you're like, yes, time compression, yes. And faster, yes.
Yes, all those things. And, I think our customers and Ambulatory in general has been very patient and they need these things now because there's just so many industry challenges coming at them.
A lot of headwinds.
Yeah.
A lot of headwinds. David, this has been a lot of fun. If people want to learn more about Greenway and the work that you do, or if it's an existing customer that wants to maybe have a conversation, like where can they reach out?
Yeah, they can go to greenwayhealth.com and of course, follow us on LinkedIn. I think it's a great place to see some of our media and announcements.
Awesome. Folks, there you have it. David Cohen. He's the Chief Product and Technology Officer at Greenway Health. Check out the show notes for the ways to get in touch with him and the company. And thank you all for tuning in to this episode. David, really appreciate you.
All right. Thank you, Saul. It's been fantastic.